Thanks for joining us today. My name is Kennedy Swallow. I'm with Healthier Washington. I'm going to go over a couple of housekeeping items before we get started. First of all, I want to let you know that your lines are muted and they will remain muted throughout the duration of today's presentation. However, if you would like to ask questions at any time, please use the question and answer chat function. That's going to be on the dashboard of your webinar. We will be fielding those questions toward the end of the presentation today. Today's webcast is being recorded, and a copy of that recording and the slides will be made available on our Healthier Washington website in the next couple of days, so be on the lookout for that. With that, I will turn it over to Mark Province.
Good afternoon. Thanks for joining. This is Mark Province. I'm Director of the Office of Medicaid Transformation here at the Healthcare Authority. I'd like to introduce the others you'll be hearing from today. Those include Alice Lamb, who is a Director at Manatt Health, who is a contractor to the Healthcare Authority. Kaylee Klein, who's Manager of Medicaid Transformation here at the Healthcare Authority. We'll also be joined, especially during questions and answers, by Nathan Johnson, our Chief Policy Officer at the Healthcare Authority, and Chase Napier, who's the Community Transformation Manager here at HCA. So the agenda today is really to focus on the project plan template, but we'll lead off with a few overview items with respect to the Medicaid transformation demonstration, especially for those of you who may not be familiar with some of the context. But we'll focus primarily on the template. We'll talk about next steps and then entertain questions that you may have. So it's important perhaps to lead with a few terms that you'll hear in today's presentation. I hope that by now all of you are familiar with the accountable communities of health. There are 9 of them in the state. You'll also hear us refer to partnering providers, which are really the key partners in the provider community working with the accountable communities of health on the development of the projects that we'll be talking about. Each ACH is responsible for submitting a project plan, which will be due later this year, which really describes the projects that each community is undertaking. The project plan template, which is really a key focus of today's conversation, is really the document that the ACH is used to describe and format the descriptions of the projects that they'll be undertaking. It's an important document because it becomes the basis on which the ACHs and the Healthcare Authority really come to agreement on the projects that will be undertaken through the remainder of the demonstration. We'll also refer to a project toolkit, which really describes the project in more detail, and many of you may already be familiar with this. You can find this on our website. And finally, you'll hear us refer to an independent assessor. This is really an entity that will be responsible for assessing the project plans as they're submitted by the ACHs, and then periodically throughout the remaining years of the demonstration, helping us by evaluating the progress of those projects as they move along throughout the demonstration's 5-year timeline. Just a note, we have a procurement out right now for that independent assessor, and we'll be making a determination over the course of the next month with respect to who that will be. So let me talk a little bit about, in terms of overview, the Medicaid transformation demonstration. As a reminder, this is a 5-year demonstration and really consists of 3 principal initiatives. We'll be talking primarily today about Initiative 1, which is transformation through accountable communities of health. But I do want to remind you that there are 2 other important initiatives that we're undertaking. Initiative 2 focuses on long-term services and supports with our partners at DSHS and the Aging and Long-Term Services Administration. And Initiative 3 focuses on foundational community supports, primarily supportive housing and supported employment. This is an agreement with the federal government that authorizes up to $1.5 billion of federal investment and is really a key component of Healthier Washington. It is important to remember that the demonstration, as is the case with our State Innovation Models Grant, these are really tools in support of our progress toward the goals of Healthier Washington in terms of healthier people, better value, and better care. really what the, to really depict what that goal is, this slide, and many of you may have seen this before, really shows how we're moving from our current system to a transformed system. And the important components of that transformed system are represented here in terms of integrated whole person care. Many of you are familiar with the efforts we've made already and will continue to make with respect to integrating behavioral and physical health services. Coordinated care, making sure that all of the components of the system are working well together. Activated clients, really engaging with our Medicaid members to make sure that they're pursuing activities and relationships that best support their own health. Access to appropriate services, timely supports for those services, standardized measurement, which is a key factor, especially in Initiative 1 of the demonstration, to make sure that we're evaluating progress uniformly and appropriately across the demonstration. And finally, and importantly, a focus on value-based payment to make sure that we're obtaining the best value for the dollars that we're investing. So really, this slide represents why we're doing all of this. We are taking a regional approach. As I alluded to at the very beginning, there are 9 accountable communities of health. They're represented by the map that you see on this slide. They have very important roles overall, but with particular reference to the project development that we're talking about today. The ACHs do coordinate and oversee the regional projects that are focused on improving the health of their Apple Health beneficiaries. The ACHs will apply for transformation projects, and again, the project template that we'll be talking about is a key way in which those ACHs represent the projects that they're applying for. It's very important that the ACHs solicit community feedback really in an ongoing way on the development of their project plan applications and, again, the conduct of those projects as they undertake them. And then finally deciding on the distribution of incentive funds to their partnering providers. It's important to take this opportunity to remind folks that this is not a grant, this is a demonstration, and so the way in which the federal funds that I mentioned earlier are available to us is on demonstrating the accomplishment of significant milestones that represent progress toward those Healthier Washington goals that I described earlier. So as we make that progress, incentive funds are earned, and the ACHs play a critical role in advising us on how best those incentive payments are distributed among their partnering providers. In terms of our progress to date, we've done a number of things, and I hope that many of you have been tracking this both in terms of our webinars, our communications with you, and our website. But these are really key ingredients in the performance of our obligations under the demonstration. They include the development of a number of protocols that represent really the details of our relationships with the federal government. You'll note here it says pending CMS approval. We've had the federal approval of our claiming protocol, which is very important to us in terms of how we claim federal funds. But before the federal government right now for consideration are planning and funding and mechanics protocols, which really describe, again, the projects that we're undertaking and how the funds will flow. And in addition, there are a number of other key protocols, a number of which you'll find on our website. We have updated our Project Toolkit based on some comments from CMS. We've really done some important reformatting. The projects themselves have not changed, but our updated toolkit really focuses more on the milestones and measures that will be applied and the timetable. Many of you are aware that we have a 2-phase ACH certification process. Phase 1 has been completed. All 9 ACHs passed their Phase 1 certification, which is really a description to us of the key ingredients that represent their organization and their relationships with their communities. And ACHs are engaged now in completing their Phase 2 certification application, which will be due in mid-August. And that's really a further demonstration to us of the ways in which they're developing and organizing. I mentioned that we've recently released an RFP for an independent assessor, and that contractor will be coming on board in the next couple months. And finally, and this will be demonstrated when I turn the microphone over to Alice Lamb. We have a district support team. We've contracted with Manat Health, and they are working very closely with our ACHs to provide them technical assistance and support necessary to make sure that they all have and submit successful project plan applications to us. So it's a very important relationship. I mentioned the district support team, and just to close out this portion of the webinar, this really describes some of the key functions that the Manat team is performing for us, supporting the Healthcare Authority and our accountable communities of health in implementing the demonstration, and especially, again, with respect to Initiative 1. And the Center for Evidence-Based Policy, which is a partner with Manat, really working closely with the ACHs through a number of regional coordinators. Each ACH has one or more regional coordinators assigned to them, and these are very important partnerships to make sure that the resources that Manat represents at a national level are brought to bear on the needs that each particular ACH has. So with that brief overview, I will turn the microphone over to Alice Lamb from Manat.
Great, thank you, Mark. Hi, everyone. I'm happy to be here with you today. So we're going to shift over now to the project plan, and I'm going to walk through the different components of the project plan template, which was released for public review and comment last week, and that public review and comment period is open through the end of this month. There will be more information at the end of the webinar just to make sure that folks know how to access a current copy of the project plan template and also how to respond. But we wanted to use the time we have here to provide some more background and context and really walk through the elements of the project plan template itself. So let's move to the next slide. So just building on the great background and overview that Mark has already started with. So this project plan, as you heard, is a really important component and really cornerstone submission by the accountable communities of health. It does provide really that blueprint of work, of the important work that the ACHs are undertaking, and that ACHs will prepare and submit these plans to convey that information. So the project plan really does serve a few purposes. One, it really will help to describe and further illustrate the readiness of these accountable communities of health to plan and implement these demonstration projects. It will provide further detail and information about really how those regional needs and community input and were taken into account and prioritized in the selection and development of projects, and really convey that overarching vision for transformation within the region. And it will provide really also detail at a project level. It will be where the ACHs are indicating their project selections of the portfolio projects that are available and that they will undertake as part of the demonstration initiative. So it provides really key information and really key planning information to understand this regional transformation. The successful completion of this project plan and that approval will enable ACHs to receive that first year of demonstration funds through this submission and approval. And we'll talk a little bit also about that towards the end as well. So let's move to the next slide. I think it's important to understand where this fits in the context, and that really that this has been a year-long process thus far, where ACHs have started, as you heard, with certification. So that phase 1 certification that begins to demonstrate the accountable community of health's readiness for being that regional lead and serving as that single point of performance and accountability for Medicaid transformation. And in that first phase, ACHs were required to respond to a number of key domains in which they were showing that real development and infrastructure to take on those responsibilities. So asked to respond to areas around really their vision and their theory of action, the governance structure that was being put into place, their engagement with tribes as well as others in the community and stakeholders. Also beginning to put more information out in terms of budget and funds allocation, and demonstrating engagement with clinicians and developing that clinical capacity to really make their project selections. And that was really the first step of the process, which all 9 ACHs successfully completed in May, and moving towards a second phase in terms of certification and building that level of readiness and evolving those capabilities as phase 2 certification, which ACHs are responding to and will be submitting in mid-August. They will be, again, demonstrating that continued evolution. So beyond those key domains that they were responding to in phase 1, there's the expectation then that continues to develop and mature, as well as additional areas that are important for demonstrating that readiness. So building data and analytic capacity in terms of project planning and selection, and really moving towards more concrete project planning and project selection. And then that culminating piece in terms of this first year of the demonstration is the creation of that project plan. So that third step here on the very right-hand side of building towards this project plan submission, really being able to show that maturity in the ACH organization and vision and capacity to take on that regional lead role, and as well as planning and selecting those projects with the input of the community to really lead that transformation in the subsequent years and implement those projects. So that submission and the project plan template, which we'll be walking through, is due in the middle of November, and the template that is out for review currently is slated to be finalized sometime in mid-July. So we're in that important public review and comment period to ensure that this project plan template does capture all of these key elements and goals of providing an understanding and demonstration of capacity at the ACH level, as well as providing important key details and readiness around how projects were selected and those projects that each region will be undertaking. So we're going to dive deeper into really those key elements of this project plan template. And so let's move on to the next slide, where we start with the first section of the project plan template. And just to give a little bit of orientation here, if folks haven't seen the document yet that's been posted, the project plan template is divided into 2 sections. The first section focuses on information that will be provided at an ACH level, and then the second section focuses on information that is provided at a project level. So an ACH, in preparing their project plan, will be completing section 1, so they're responding for their overall entity within section 1, and then for the number of projects that they select, they'll be submitting a section 2 of the project plan itself. So there will be multiple section 2s that would be submitted that is related to the number of projects that is selected. So let's first start on the section 1 of this project plan template, and this provides a good snapshot of the information that's being requested at the ACH level, but we're going to spend also the next couple of slides just giving a little bit more detail underneath of what's being asked for in each of these sections. But as you can see, these are 7 key domains that really build from and bridge from those phase 1 and phase 2 certification requirements and capacity, so around governance and theory of action and engagement and funds allocation. But again, is shifting now towards the project selection and planning, and really tying that capacity and level of development to how that translates in terms of then the overarching plan for the ACH and plan for carrying out these Medicaid transformation projects in the region. So let's dive deeper into all right, so let's go to the next slide, please. So we're going to go into this first section, and within this section 1, we start first with the regional health needs inventory. So each ACH will be asked to provide and describe how they have applied a field-driven approach in terms of identifying needs in their region, of understanding the population that is being served, and really helping to document those needs and using data to identify the projects that are being planned for and selected in terms of Medicaid transformation. As part of that as well, in terms of applying that data, there's also a request here in terms of identifying real capacity or access gaps, which then are further discussed in other parts of this template. So starting off in terms of kind of setting out that overarching understanding of what do the regional health needs look like, and how should the ACH and how has the ACH prioritized those projects against those identified needs based on the data available. So then moving on to the next section here, so the theory of action and alignment strategy. This is really identifying that key vision and strategies for Medicaid transformation, and really how will the projects that are selected really work together to achieve that key vision. Again, really paying a close eye to understanding how ACHs will address gaps and think about gaps and address those as they're carrying out these transformation activities. But again, that builds from identifying needs and identifying and articulating this vision and laying that out against the projects that are being selected. So then we move towards really the kind of capacity and of the ACH here. So we move into the section where ACHs are asked to respond to really the demonstrated capacities that are needed to be that regional lead entity. So how the ACH is providing the financial, clinical, community data, and program management oversight, those very key areas to serve as that regional lead entity. And also ensuring that they're addressing that process by which those key partnering provider organizations are participating and ensuring performance. So they will respond to that at an ACH level, but as you'll see later, they're also sort of taken this at a lens of the project level. So moving to the next slide, again at an ACH level, the ACH will need to be speaking to that important element of community and stakeholder engagement. That should be an ongoing process that the ACH has engaged in throughout this development and evolution in the first year, but really critically around project selection and planning, that there is a specific focus on really demonstrating that the ACH has solicited and engaged with community members to help to inform project planning and selection, and that there's that commitment ongoing for that level of community and stakeholder engagement. This is also one of the key areas where the ACH will be required to be providing additional attachments and evidence to support the discussion in this area. Another key aspect in terms of engagement and collaboration is with tribes, and this is also a key area where ACHs will be asked to describe either direct engagement with tribes and Indian healthcare providers, as well as describing just how American Indian and Alaskan Native needs have been acknowledged and really focused on in terms of the projects that have been selected and planned for. And then moving on to the last two remaining areas in this section 1, one area is around funds allocation, and again at an ACH level, that one of the key tasks here and one of the key areas is that the ACHs will be serving as that single point of accountability and as that regional lead in coordinating these projects. Will be in that lead role of managing and overseeing demonstration funds that those projects earn. So in this section, there is a significant discussion around how the ACH is fulfilling those roles, how the ACH has put in real structures to ensure that they're being good financial stewards and ensuring a level of transparency also with respect to the demonstration funds that are earned and how those funds are allocated. And then finally, critically, there are also a set of projects that really cross-cut. So rather than each individual project that is further addressed and identified and selected by ACHs, there's also sort of a body of areas of focus here around capacity development that underpin really the transformation of the healthcare delivery system. And the way that that is approached here is first sort of really taking the holistic view and thinking at an ACH level how this body of work was really undertaken and focused on across projects. And these key areas are really focusing on key strategies and key activities that will help to ensure the success of the transformation and to help to ensure the long-term sustainability of these projects. So really how to kind of build and continue to expand capacity around value-based payment, also how to ensure and build and continue to expand capacity to ensure there is appropriate workforce and addressing any workforce gaps that might be identified. And then finally, also how to leverage and continue to expand the use of population health management systems. So really recognition that these are really three critical capacity areas that are necessary and must be in place to really ensure the success of these projects. And in this area of the project plan, the ACHs are really addressing then these strategies overarchingly. So we closed out on the first section, which focuses on the ACH level, and then moving on to the second section of this project plan or project plan template is really at that project level. So as I mentioned at the top, for each project that ACH is selected, and they will be selecting at a minimum of 4 and up to 8 projects, they will be submitting a section 2 for each project. And so each of these section 2s really focus at that project level and cover 9 important areas in that specific project. So we'll walk through again, similarly as we did with section 1, really what's being looked for in each of those sections. So let's move to the next slide as we go a little bit deeper. So first, at a project level, ACHs will be asked to really provide a justification and convey an understanding of how that project was decided upon and selected, so and that connection to the regional priorities and the data-driven assessment that ACHs are undertaking, and how that particular project was identified, how that scope was identified, and what the anticipated scope of that project will be. And that scope would include what target populations and particular providers that the ACH is targeting and thinking about crafting this project. In addition, as part of the section, ACHs will also be addressing how they intend to address any geographic disparities and speak to the expected outcomes of this project. So again, providing sort of that context and understanding of this, how this fits into the larger strategy, how this was driven by the needs and priorities that were identified, and the particular targets of this particular project. And then thinking about how to carry out that project is the next section. So ACHs will be needing to speak to really that approach and timing of the particular project. And be able to speak to and describe the project's implementation approach. And that will track to, there was mention of the Project Toolkit earlier in this webinar, but that there are sort of defined set of milestones and a defined set of stages in terms of how implementation unfolds for a project, and the ACH will be needing to speak to how it will progress through each of those stages. Understanding, though, that in the second year of this demonstration, the ACH will be taking an even deeper level and really kind of focusing on developing a deep implementation plan and set forth with that project. And then in terms of those domain 1 capacities, again, those key value-based payment, population health management strategies, and workforce strategies, focus areas. Again, given the importance of these key strategies, ACHs will also be asked to speak to that at a project level and understanding how those really help to drive and how they were thought about in the context of a particular project. So ensuring that there was infrastructure both in place and that those areas are being leveraged to the maximum extent possible, but also thinking about how projects will help to also drive the development of these key areas. So then moving to the next slide also, again at a project level, ACHs will be speaking to those partnering providers or partnering organizations that will be playing important roles in these projects. So at this stage, and I want to emphasize that these partnering organizations will be identified at a preliminary level. So understanding that there are ongoing discussions and work to be done, but that this provides information on understanding sort of the level of engagement and the level of participation thus far in these projects and in securing participation of partnering providers. Again, this is something that as you look to the next year of the demonstration, there will be, again, more of a finalized list and commitments that are secured as part of the projects themselves. And so continuing on to the other components of this section 2, so regional assets. The ACHs will also be speaking to how current regional assets are being leveraged. Again, seeking to look to, providing some forecasting around anticipated challenges and how to address those challenges. So again, ensuring that there is appropriate planning and thinking at the project level about how to best leverage resources that are available, how to best mitigate against unintended consequences and address any barriers that may arise. There's an expectation that there is continuing monitoring and improvement to ensure the continued progress in these projects, and in particular at the project level, an ACH is also asked to be speaking to how they will be carrying out that particular monitoring and how they will be ensuring partnering providers are continuing to move down that transformation path and continuing to help to show improvement in terms of the project. And again, taking kind of that look again about how to best put structure in place and put processes in place to ensure that there is good monitoring and continuous improvement occurring. So then moving on to the next and final slide, I believe, in this section. So again, at a project level, an ACH will be asked to speak to, thinking about this, carrying on this project and its transformative effects for the long term. So really kind of taking that forward-looking perspective of how, beyond the lifetime of this demonstration, this can be continued long term. And then the last two here are attestations, actually, in terms of important responsibilities, though, that the ACH will need to be undertaking as that single point of accountability and as that regional lead. And they specify certain responsibilities that the ACH will be taking on, which in this section around project metrics and reporting specifies some of the reporting responsibilities here that the ACH will be expected to carry on in terms of reporting progress and providing key information and assuring data access. And then also, importantly, responsibilities and this relationships with other initiatives of ensuring that there that funding sources are working together, but not supplanting or duplicating other funding sources. So an expectation here of ensuring that demonstration funds and demonstration initiatives do not duplicate with other initiatives and are really being undertaken in a coordinated way. All right. So then those are the sort of key substantive components in terms of Section 1 and Section 2. Just a quick pause in terms of the next slide is just giving a sense of how ACHs will be responding. There's a variety of formats in terms of the way the project plan template is structured, but that there will be narration and narrative that is being provided by the ACHs for the majority of the content that I just reviewed, with specific word counts that are indicated in the template itself, but really that the ACH is providing a robust description and information about how it is meeting each of these requirements and its planning process and its project selection. There are a couple of attestations which we just reviewed that are critical duties that the ACH needs to attest to undertaking in future years. There are also a couple of areas of attachments that help to provide supplementary evidence and substantiate some of that narrative description that are being requested as well. And then finally, there is a supplemental workbook that will be completed that provides some more in-depth detail on some of these key sections. So in terms of funds distribution, there are some more detailed tabs that need to be provided by the ACH. On the implementation approach, that's also how that information will be displayed in terms of providing key details on the implementation steps and timing, as well as partnering organizations, so providing a level of detail around those preliminarily identified partnering organizations. And that workbook, I should say, is also has also been released for public comment. So there is a PDF document and an Excel that are available for review and further comment. All right, so then finally, wanted to move to the next slide here to provide some of the preliminary thinking around the project plan scoring. And then we'll talk a little bit just about how that project plan scoring then relates to the incentive funds that are released at the end of the year. So in terms of this project plan that we just reviewed and how that will be scored, so the project plan scoring itself is going to be based on several factors. So it will be based on the quality of the responses that have been provided by the ACH, both on that Section 1 ACH level as well as on that Section 2 project level. And again, as a reminder that the Section 2 will depend on the number of projects that an ACH has selected, because they can select between 4 and 8, so they will be turning in between 4 and 8 Section 2 components that respond to each project. And then there is a final factor in that consideration in terms of the number of projects that are being selected by the ACH that also builds into that scoring. So then we have on the slide below just how that framework will work. So in terms of the scoring, that Section 1, the ACH level response, will account for 30% of an ACH's project plan score. The Section 2 project level will account for 70% of the ACH's score. And since we will be dealing with multiple Section 2s, the way that will be arrived at is really averaging the scores of those Section 2 submissions together to get at an average level that then feeds into 70% of that score. So then each of those Section 1s and Section 2s will be scored out of 100 points. A minimum of 60 points will be required in order to continue to move on. And then as you put those components together, you first get a project plan score and would be at a percentile. And that percentile then then calculates to the level of demonstration year 1 incentive funds that will be awarded to that ACH. Now, there is a consideration, though, in terms of the number of projects that are being selected, and that's what the right-hand side of this reflects, such that for ACHs that select beyond that minimum of 4 projects, that there is additional consideration. So as you see, as you move up that scale in terms of the projects, for selecting an additional project to selecting 5 projects, that there's an additional percentage of the available funds that can be earned. And then for selecting between 6 to 8 projects, again, that builds in terms of the additional percentage of funds or percentage of score, as well as a possibility of earning funds that may not have been earned by another ACH. So we're dealing with, an overall set amount of dollars that are available by year for the particular for the demonstration, and we're dealing with a particular set of funds that are available by ACH that is distributed by Medicaid attribution, but overall, so that sets sort of the overall pot, but this project plan score helps to show how that valuation is earned based on that consideration of the quality of the application, which responds again at that ACH level and a project level, and then in consideration of the number of projects that are being selected. So an ACH could earn up to its max valuation if it selects at least 6 projects, and then between 6 and 8 projects also could have the opportunity to earn additional funds that have been unearned by other ACHs. Okay, so I think with that, I'm actually handing it off to Kaylee for next steps.
Thanks, Alice. So we're just going to cover a few important dates in the next few slides, but I'll use this as an opportunity to remind you that if you have questions, please type those into the question chat box, and we will be answering those questions in just a minute. So start typing those questions in if you haven't already. So this is, we are about midway through the first demonstration year under the demonstration. And here's just a quick snapshot of some of the activities that are occurring under Initiative 1 for the next 6 months. So as you can see here, we are in the middle of the public review period of the project plan template, and we are targeting mid-July for the final, for that final plan to be released, with the target of a November 16th due date. I'll note that that date was previously October 23rd, and so that has been pushed back a few weeks. So that is a newer information and an important date to remember. Just going to the next slide, this is a less visual way of repeating some of those important dates. So as we had mentioned at the very beginning, ACHs have passed phase 1 of certification, and that had occurred last month. Their phase 2 certification applications are due August 14th. Mark had also mentioned that that is August timeline is when we are anticipating announcing a successful bidder for the independent assessor. And again, here as mentioned, that November 16th deadline for project plan submissions, and that we would be having the independent assessor reviewing those from November through January. The project plan template, if you are looking for that, that is on the Medicaid Transformation webpage. There's a link there, and all public comments and feedback should be sent to the Medicaid Transformation inbox, which is medicaidtransformation@hca.wa.gov. Again, that public comment period is open now through June 30th. Just some things to consider as you're reviewing is particularly is there something missing or is there something confusing that we really need to clarify before that final is released in mid-July. And going to the next slide here, this is where you can find many of the resources that have been referenced throughout this webinar, including the draft project plan template. Additional materials are copies of the protocols that have been submitted to CMS. We have posted ACH Phase 1 certification applications, and in the next few days are anticipating an update to our frequently asked questions document and glossary. So continue to check back as we are continually updating this website with resources, and we'll also be posting this webinar recording, as Kennedy mentioned, in the next few days. So with that, we are going to now shift over to some questions and answers for the remaining 10 minutes. So in addition to Mark and Alice, we're also joined by Nathan Johnson and Chase Napier, who are going to be on the hot seat here for some Q&A. So keep them coming. All right, so we're just going to go ahead and jump in. So I'll open this question up really to Nathan, Mark, or Chase. Is there any additional information on sustainability of funding for these demonstration efforts in the next few years or after 5 years?
I can take a first shot at that question. Thanks, Kaylee, and this is Nathan talking. A few things we can be certain of with regard to the demonstration. First and foremost, the incentive dollars that we're discussing as available here end after year 5. So the incentive dollars themselves are very temporary. The other thing we are certain of, and it's a key milestone in this demonstration effort, is the conversion of our Medicaid purchasing into value-based purchasing. That is, we have set a target of 90% of all dollars spent under the Medicaid program being tied to value-based contracts by 2021. So what we believe is very important is that our purchasing reflects the transformed health system that we're actually trying to achieve, and value-based payment is a chief component of that. And the value-based payment action team has actually had their first 2 meetings under Mark's leadership, that's chaired by Rick McCormick, and they're making great progress, I think, in informing and shaping that vision for the next several years. But this is both a care transformation effort as well as a business transformation effort to support a reformed delivery system. And Mark or Chase will check to see if you want to add anything to that.
This is Mark. I would just add to that a lot of the groundwork that we're laying actually predated even the demonstration with the development of the ACHs and the identification of the Healthier Washington goals. So those, of course, will continue, we hope, well beyond the close of the demonstration. It's also important to note the important role not only of the ACHs and their partnering providers, but of our managed care organizations with whom we contract for the delivery of Medicaid services, with the idea being that the initiatives that are successful and the interventions and transformations that we're able to achieve through the demonstration are intended to be incorporated really as we go forward with our purchasing and delivery of Medicaid services. And it goes back to what Nathan was saying about the importance of incorporating value-based payment as well as fully integrated managed care. So we believe we're laying some important foundation stones, but that will contribute to the sustainability of effort beyond the end of the demonstration.
Great. So the next question is asking if for each of the 8 projects, whether more than one evidence-based approach can be selected. And I can just go ahead and say that there can be multiple pathways under a project, whether that is selecting one of the evidence-based approaches listed, combining evidence-based approaches, or applying different evidence-based approaches for different target populations for the project. The one thing that I would just say is that for Project 2A, which is the bidirectional integration of care project, there's actually a requirement for two approaches there, so that we are making sure that we are getting to that bidirectional nature where we're integrating primary care into behavioral health and behavioral health into primary care. So that is the one exception where there is a direct requirement for two evidence-based approaches. Moving on to the next question, we can start with Chase or Mark here. How can an organization or provider become a partnering provider?
This is Chase. I'll start by saying there's a lot of progress being made at the regional level through the ACHs, and so we want to help any interested organization or potential partnering provider to get engaged in the ACH work. That's one of the best ways to get a better sense of where each ACH is at in the process of both selecting projects, thinking about specific strategies or evidence-based practices, as Keely just talked about, target populations, etc. So getting involved in the regional conversation is going to be one of the best ways. But we're also, as a support team here at the state, happy to make those connections and find other opportunities for engagement as we can. So we have all of that contact information. I think there's a resource page linked on the webinar slides. So don't hesitate to reach out to us or to the ACHs directly. But really, we can't replace the level of activity that's happening at the community.
Great. So we'll ask this next question, which we tend to get during these webinars. I'll ask this of Nathan. What happens if at the federal level there are changes to the Affordable Care Act? Can the federal government withdraw the funds supporting this demonstration? And if they withdraw the funds, is there a backup plan?
Sure. Well, I will say the work of Healthier Washington, very importantly, predates the demonstration. And so we've made broad commitments for delivery system transformation and beyond the Medicaid program, of course, dating back all the way to an innovation plan that we completed in 2013. So I think that's something to keep in mind. The demonstration does provide a significant influx of additional resources to help us, though, on implementation. The thing I'll say about the federal environment is the 5-year demonstration is a binding agreement between the state and federal government. It is not itself dependent on specific elements of the ACA necessarily. In fact, specifically, is not financially dependent on the Medicaid expansion population. So even as we track very closely with all of you discussions at the federal level, this demonstration is binding on both parties, and the dollar flows are not dependent on any of the provisions presently within the ACA. So I'll probably stop there. Suffice to say, we're moving forward with implementation and with great optimism that this process will continue independent of any federal changes. But of course, recognize the concerns associated with any potential loss in coverage of the type that's been proposed so far that would have a demonstrable impact on the Medicaid program and not something we're ignoring even as the demonstration goes forward.
Great. So we are, I'll just say we've got 3 minutes left, and you guys are asking a lot of questions, which is great. If we don't get to all of them today, we will, please continue to send them in through the chat box, or you can also send to the Medicaid Transformation inbox, and we can make sure that we are building those into our future FAQ documents and other resources. Several questions have been coming in around the preliminary scoring. That was the last slide that Alice spoke to. We understand there's a lot of questions around this, and I'll just say that that was a preliminary approach that we wanted to introduce during this webinar. There will be a lot more information forthcoming that will describe that in further detail. So we'll hold off on some of the specifics of those questions now, but just know that there's plenty more coming to really make sure that everybody understands that approach. Again, and that is a preliminary approach that we are still working through, so nothing about that is final at this time. So back to just a couple questions in the remaining 2 minutes. I'll open this up to whoever wants to respond. If a new provider group or delivery systems want to join an ACH project in progress, is that allowed if they were not identified in the original project plan?
This is Mark. I'll start. let me start by saying it's incredibly important that providers within an ACH region pay attention to the development of the projects and become involved as early in the process as possible. And I say that because it gives the partnering providers the best opportunity to really inform the development of the project at the ACH table, as opposed to trying to catch up later on. There's nothing that would prohibit a provider from joining an established project, but again, the downside of that is the sacrifice of the opportunity really to become involved from the start in the development of the project. I'll also mention that because these are incentive funds, one of the things we pointed out in earlier webinars is that the milestones that are represented in the earlier years of the demonstration are really more process-oriented and recognize that there are planning activities, developmental activities that may be entitled to incentive payments as a project progresses. Those then move to more outcome-based milestones in the latter years of the demonstration. And I mention that because, again, if a provider sees an opportunity to really engage in some of those planning and developmental opportunities, there's an opportunity for the provider to have incentive funds that go to support that kind of engagement. So I really would encourage providers to really jump in earlier rather than later. Even if you're not willing to commit right away, making sure that you're informed and you're partnering with the ACH, I think, is incredibly important.
Thank you. And we will just do this last question. I'll ask Nathan to respond to this. This is a question around allowable use of earned district funds. So specifically in this example, can ACHs use district funds to create a regional reinvestment fund?
That's a great question. There are flexibilities and then those things that are not flexible. For sure, the Project Toolkit, the planning document that's been circulated, as well as the project template, absolutely provide for how incentives are earned, and we will be held to that in our negotiated agreement with CMS and the protocols they are approving. What that does not stipulate is how partnering providers and how ACHs as well spend those dollars once they are earned. The earning is very directed and very deliberate. The expenditures of those funds, how they're used to support further transformation activities regionally, is for an ACH and its partnering providers to decide. So there will be more clarity and guidance on that subject, but I do want to be clear that there is certainly flexibility, just as there is for many Medicaid incentive programs, for once that incentive has been earned, how that incentive is then utilized. The other thing I should be clear about is once the project plans are submitted, that is binding the ACH and its partnering providers to implementing those projects. So to be clear, while incentives can be used for many different purposes conceivably in a region, it is important for an ACH to consider what investments are needed for it to make good on its initial commitments to those projects to ensure that they achieve the performance targets and milestones that ultimately drive incentive payments over the course of the demonstration.
Great. All right, with that, I think we were 2 minutes over. Thank you all for joining us over the lunch hour today. Again, if you have additional questions, please send us an email, and we will be logging all of these questions and continue to check back for more resources, more information, and make sure that you join the Healthier Washington Feedback Network. Thank you.